Thank you, Julie, and welcome everyone to session 4, Acting Before the Hour of Need, Prevention of Harm to Children in Humanitarian Settings. It's great to see you all online with us. The aim of this session is to contribute to a mind shift that is necessary in the protection and broader humanitarian community to recognize prevention as a critical element of humanitarian action. We will start with some opening remarks and what we know and why to invest in prevention humanitarian action. We'll look into definitions and an overview of where the child protection and humanitarian action sector has got so far, how it is relevant in the broader protection and humanitarian community. We'll listen to some good practices, two good practices from the field, and we'll have some donor reflections as well. And in between, we do some polls as well to keep you occupied. But to start this session 4, we'll start with opening remarks. And just let me see if Shima is online or whether Hani will take this on.
We've not seen her arrive yet, Ron, I'm afraid. So I think it'll be Hani.
So we'll hand the floor to Hani, is the Senior Coordinator of the Alliance for Child Protection and Humanitarian Action. Hani, over to you.
Great. Thank you very much, Ron, and all the organizers, and to the GPC for this opportunity. And I know that Shima Sengupta, who is the Director of Child Protection within UNICEF, would have loved to be here, and it seems that something unexpected has prevented her from joining us. So I'm going to try to step in her shoes and say a few things that we had discussed that she would probably want to cover. Probably not. I won't be able to do it as eloquently as Shima would have, but I will do my best. So humanitarian crisis, conflict, violence, they're all breeding grounds for complex and interconnected risk factors that time and time again lead to harmful protection outcomes for children. Whether that harmful outcome is separation from family and caregivers or recruitment into armed forces and groups, whether it's child labor or forced marriage, they all impact children's lives in a devastating way. And in many cases, the impacts are irreversible. We know also from a lot of research that has been happening that these kinds of experiences hamper children's well-being and development, and they adversely affect their both physical and cognitive, but also emotional and social development of children. A lot of research has shown how, for example, a child that experiences violence or separation longer term has even a lot of additional health issues that in probably 50 years ago we didn't know that these impacts exist. But also, we know that a lot of the harm that takes place within humanitarian crises are preventable. Not all of them, but a lot of them are. And if they are preventable, then it's our moral duty to do so. And learning from some of the other sectors, especially the public health sector that has spearheaded this approach to prevention, we know that this is doable at the population level, at really large scale. Sometimes when I talk about populations, I also mean subpopulations, but we're talking about large scale. These are doable and has been done in the past. We also recognize and know that children and their families, their communities, their societies, they all have their own protective mechanisms. Some of these are related to children themselves, like their own agency, the peer networks of children. And some of them are about families, the ties that families have with other families, communities, and broader societies. All of these exist, and it's our responsibility to help those protective mechanisms to be able to prevent harm, again, at large scale. These can be done at large scale. We all have a responsibility to uplift these protective factors within societies and families. Now, I know Shima would have wanted to talk a little bit about the focus that UNICEF has specifically on the topic of prevention, and within the strategy of UNICEF, you will note that they call it universal prevention, which is the same concept as when we talk about it, we talk about primary prevention. UNICEF has in the past few years done a significant shift in their strategy and strategic approach towards focusing more and more on prevention. Now, this is not at the expense of response or remedial action, but it's in addition to continuing to respond to the needs of those children that have been harmed, but also preventing harm in the meantime. So the recent UNICEF child protection strategy that goes from 2020 to 2030 has a very clear focus on prevention, with a very clear focus on primary prevention within the broader spectrum of prevention. The strategic plan of UNICEF as an organization also includes a strong emphasis on prevention. UNICEF is doing a lot internally within its workforce to kind of facilitate that lens shift that is required for actors on the ground to be able to do more prevention work than we have been, and UNICEF has been doing, and other partners of UNICEF have been doing in the past. Again, I'm speaking on behalf of Shima here, so hopefully Shima will approve of all of this. UNICEF, I believe, is also very strongly working internally with other sectors that exist within UNICEF. So child protection, working with education, with health, with nutrition, to make sure that the root causes of harm are addressed for children at large scale, so that it prevents harm. I will talk a little bit now that I've tried to mention some of the elements related to UNICEF specifically. I'll also talk a little bit about the investment case for prevention. All humanitarian actors across sectors and levels of policy and practice have the ability and the responsibility to more consciously and consistently address the risk factors of child protection harm. We believe that prevention is a key component of humanitarian action for the following reasons. First, it's an ethical responsibility on the part of all humanitarian actors to prevent harm to children if it's possible. And we know in many cases it is possible. Secondly, addressing root causes of harm to children improves the sustainability and long-term impact of humanitarian response. Thirdly, preventing harm before it occurs increases the cost effectiveness of child protection interventions. Evidence from other sectors and from non-humanitarian child protection efforts have shown how preventative approaches are significantly more cost-effective than response-focused programming. By allocating resources towards preventive strategies, we not only protect children, but we also save money in the long run by reducing the need for costly response interventions. Now, why is it important that we think about before the hour of need, which is the title of this particular session? If we wait to act until the crisis breaks out and until the harm is done, so these are 2 points. One is a broader point in the kind of the lifetime of the emergency, quote unquote, and then the lifetime of harm to a child. If you wait until then, it's probably too late. At that time, many children are already harmed or at very high risk of harm. So a lot of the work that we need to do on primary prevention starts before the crisis and then continues into the crisis. So every day in a conflict or a complex emergency, and a child is at the risk of getting separated. So every one of those children have the potential of being separated, and we have the potential of preventing that separation. Anticipatory action is a very promising platform and approach to work through to achieve some elements of preparing ourselves to be able to be more preventative in our approach. And I believe UNICEF is pursuing this particular area of work and working with other sectors within UNICEF to make sure that anticipatory action is child sensitive and specifically looks at child protection. Ron, I would like to hand back over to you here. I have a little bit more that I was going to cover in the next section, but I will come back in then, if that's okay, unless you want me to continue and cover that other section.
Perfect, Hani. No, this is fine. We'll surely come back to you, and thanks so much for stepping in there. We're now moving to the next part. We'll start with a Zoom poll, or we continue with the Zoom poll. This will be the first one, and it's an open-ended question. And the question is, what types of prevention interventions have you been involved in? And you have 1 minute to answer that question. So what types of prevention interventions have you been involved in? And here we'll see some of the results that have come in. Community protection committees developing community preparedness plans, sensitization of teachers, childcare services for communities that are not able to support their child services, anticipatory protection measures in humanitarian crisis, Girls Shine GBV prevention program, social behavior change, intergenerational dialogue, male engagement. So quite a number of prevention measures, and it's good to see that you have those prevention measures in place and are starting to or continue to work on them. As Hani mentioned, this is extremely important, and that we go beyond the usual just response to really a mind shift of looking into prevention. Now we'll continue setting the scene, and we'll be looking at a short video, Sarah's story, which probably many of you are familiar with. And after this story, this video, we'll be looking at another question. So keep that in mind when you look at the video. What interventions could have prevented Sarah and other children in the camp from facing harm? So we'll now look at Sarah's story.
This is Sarah. She is 12 years old and lives with her family in a camp. Sarah enjoys playing with her friends and her younger brother and sister. She was attending school, but was frustrated at her poor grades. She had missed many months of school due to fighting in her town. When she did not understand something in class, Sarah stayed silent and did not ask any questions. Because there were too many children in the class, her teacher did not even notice Sarah was struggling. Some of Sarah's friends had gone to work in farms, instead of school, and Sarah decided to join them. Sarah's parents have not been able to find work. Her father had to leave his carpentry tools behind when they fled from the fighting, and he does not have enough money to rebuy the tools to start working. Not having an income makes both her father and mother very frustrated and angry. Sarah's family has to rely on irregular distributions from humanitarian agencies or help from neighbors. This is often not enough to adequately feed Sarah or her family. Sarah's parents know she is not doing well in school, but they are overwhelmed, and when she decides to stop going to school, they do not protest. Sarah spends 12 hours per day, in the rain or hot sun, working on the farm. The children are not treated well, and have been hit, if they take too long a break. Sarah also has to walk a long distance before sunrise to get to the farm each day. During her journey, she is afraid of who she may meet along the way. While Sarah may be happy to earn some money, the work makes her tired and afraid. She begins to worry about her future if she does not go back to school. Today Sarah is meeting with a community worker. The community worker is eager to connect Sarah and her family to services that may allow Sarah to return to school. But she wonders, what could have been done to prevent Sarah from experiencing child labor in the first place? What could be done to prevent other children from experiencing harm in this community?
Now we've seen the video, at least part of it, and we'll be asking you the next question, which is, what interventions could have prevented Sarah and other children in the camp from facing harm? Again, you have 1 minute to answer that question. Okay, so we've ended the poll. We see we have 13% of participants who responded to the question. So, what interventions could have prevented Sarah? So, we've seen as answers livelihoods, support for the family, again, livelihoods, individual protection, cash, being close to Sarah, be it at school or at home, understand Sarah's situation, implementation of child-friendly safe space activities, economic empowerment, so livelihoods, counseling, raising awareness, providing caregivers with appropriate income-generating activities, to get decent basic and social needs of life, additional classrooms near the camp, building her self-esteem, awareness sessions on the importance of school, and also for parents to show the importance of school, case management, cash voucher assistance, to have a non-formal education program, and platform for the community to raise issues, awareness sessions for teachers, and community awareness creation services. Okay, let's see what we could look at in terms of the primary prevention strategy that could have prevented, could have provided prevention. So, what could have been done to prevent Sarah and other children from experiencing child labor? So, as many of you mentioned the cash and voucher distribution to all families in the camp. And you've also added there providing the opportunity for livelihoods, rather than just handing out cash or vouchers. Information campaigns on risks faced by children when working in the farms, which many of you also mentioned, and you've also included there the awareness raising of communities and parents, and improve the quality of education, teacher training, adequate salaries for teachers. Again, this is something that came up in the answers that you provided. So the message is that clearly that humanitarian actors have a responsibility to prevent harm to children before it happens, whenever possible. Preventing harm to children is possible. And with that message, we will go to our next speaker. Not a new speaker. Hani kindly stepped in earlier. So Hani Mansourian is the coordinator of the Alliance for Child Protection Humanitarian Action. He will take us through some introductions around prevention, developments in the CPHA sector, an overview of tools. Just to remind you that you can use the Zoom Q&A function for questions, and we will take questions at the end of this session. Hani, without further ado, over to you.
Great, thank you very much. And apologies for coming back again. I wish we had Shima, so I wouldn't have to speak twice. But yeah, so I will be basically walking through some of the things that we have done within the child protection sector, particularly child protection and humanitarian action sector, and under the Alliance Prevention Initiative in the past few years to promote this kind of lens of prevention. So if I think there are slides that will be shared. So some of you probably know that the child protection sector came together about, I would say, 14, 15 years ago and tried to define what child protection is. And the definition that you see on the screen now is more or less this has remained the same since then. Of course, the work of child protection goes way beyond the definition, but this definition, which is the first official definition of child protection and humanitarian action, from the beginning has included the term prevention. So it has been part of our definition from the beginning. However, the prevention element has not been as successful as the response element. So you see that we're talking about prevention and response to abuse, neglect, exploitation, and violence. But the response part has advanced quite a bit. If you look at the way we program in the sector, majority of our, with exceptions of, I have to say, there are preventative approaches that are employed, and in some areas of our work, particularly child marriage, mine action, prevention has become quite a bit of a centerpiece of the response. But a lot of other specific child protection and humanitarian action services focus on response, whether it's child labor or separation of children from their families, or children associated with armed forces and groups. We are very good at responding, of course, if you have the resources, but not as good at in preventing. Now, there are many reasons why this has happened. Not that we should justify why we are not doing as much prevention, but there are good reasons. In the middle of an emergency, there's this very human tendency to try to respond to the needs of those that are already harmed, rather than kind of thinking a bit long term and thinking about addressing root causes or strengthening protective factors. Resources are always scarce. Time is always limited in an emergency. So all of these explain why we're not doing enough, but they don't justify it, because we still know that harm is preventative, or in emergencies, a lot of harm is preventative, and it becomes a moral duty for us to prevent it. Now, when we talk about prevention, I wanted to talk specifically about the different levels of prevention. If you can go to the next slide, please. So within the public health model of prevention, which is kind of the source of this approach to primary prevention, we talk about 3 levels of prevention. We talk about primary, secondary, and tertiary. Primary being, and you see it at the top of the pyramid, being the approach to address root causes of a harm, rather than acting after the harm has taken place. Now you see that because the reason it's at the top of the inverse pyramid is that it shows that if you do primary prevention, most of the cases or children that we deal with in a humanitarian setting should fall within this service provision. So the primary prevention service provision that takes place. Secondary prevention is about addressing threats and vulnerabilities of an individual child that has already been identified as being at high risk. So it starts going into the realm of case management and identification of an individual case. And tertiary prevention, that sometimes gets very close to response, is when a child has already been harmed, but we want to prevent additional harm from the child, or the reoccurrence of the harm to the child. And as you see in the diagram at the bottom on the right, we have responsive and remedial action, which basically means tertiary prevention a lot of the time is mixed and entangled with response and remedial action. So we have been doing as child protection a lot of tertiary and secondary prevention as part of our case management work primarily, but not as much on primary prevention. And in primary prevention, focus on addressing root causes has been the shift, the kind of the mental shift or the lens shift that has been needed for us to be able to think about root causes rather than think about the harm itself. Again, in no way we are suggesting that we shouldn't be responding to the needs of those that are harmed, but we need to add the prevention lens to it. Now, in the past many years, I think since about 2018, the Alliance has started having a very specific focus on prevention, on primary prevention. And in our recent strategic plan development from 2021 to 2025, we basically have found that our constituency, the sector, is asking us to maintain a focus on prevention. So there has been quite a bit of improvements in that area. The work around Inspire package and centrality of protection policy are two of the elements outside of the Alliance that have really helped us in making the case for prevention. And sometimes they use slightly different terminology. Also, for example, the GBV sector has done quite a bit on risk, what they call risk mitigation and prevention. That has a huge overlap with what we are doing in terms of prevention. So we, as the Alliance, we aim to have increased prioritization of prevention funding and programming in the field. We would like to see more growing knowledge and capacity and understanding of what child protection prevention actually means. And we would like to, and we have been trying hard to engage other sectors in incorporating child protection prevention strategies specifically in their humanitarian work. In order to achieve all of this, about 5 years ago, we started with a USAID Bureau of Humanitarian Action funded project. We did a very extensive desk review that helped us understand what kind of practices exist, what kind of evidence do we have about prevention within child protection, both in humanitarian settings and also development settings. And this desk review helped us develop a primary prevention. Can go to the next slide, please. A primary prevention framework that defines the guiding principles and provides a frame on how to use prevention approaches as part of the program cycle, from preparedness to assessment to evaluation and to learning. The framework is currently being field tested with many thanks to BHA as the donor and Plan International as the implementer in South Sudan and Niger. And it's providing us with valuable learning that will then be fed back into the framework and hopefully improve it. While this framework is developed within the child protection sector, we have both borrowed from other sectors, but also it can be very useful for other sectors, particularly protection, because of the closeness of the nature of the work that child protection do with broader protection. The structure of the framework can hopefully be very beneficial for protection actors beyond child protection. So in terms of challenges and limitations, of course, challenges remain. It's not easy to have a mind shift and a lens shift so quickly in a sector that has been doing something for decades. But we specifically struggle with the issue of the understanding of what primary prevention actually means. A lot of our colleagues who are working in the field and do prevention, but they do it at the secondary and tertiary level, they feel that they are doing prevention, therefore they don't necessarily think about the primary prevention element, which should be done at the population level or subpopulation level and can have large-scale impact. Research has been very limited in the area of prevention and showing the impact of preventative programming and how it impacts children's well-being. And we are now trying to more and more focus on these areas and have an emphasis on these elements and have that hopefully lens shift that needs to happen to take place. Now, a couple of last words, and I will hand back over to Ron. Our key message here is that preventing harm to children is possible, and it's everybody's business. Now, while leadership on preventing harm to children might fall under the child protection sector, but its actual implementation goes way beyond child protection. It's just not physically possible for us to be able to do it within the sector alone. As you saw in the case of Sarah and a lot of the answers that you guys gave, some of those answers would require services or programs within child protection. For example, when we are talking about social norms or talking about awareness of parents regarding the harms that can come to a child if they're in child labor, those are within child protection. But livelihood, education, those are outside. But it's still our role as child protection to be able to ensure that those services are being provided. Multi-sectoral approach to children and their well-being is critical in the work of prevention. The IST centrality of protection policy has been instrumental for us to be able to push the agenda of prevention, and we hope to work with protection actors more on this. And lastly, we acknowledge that donors play a critical role in making sure that investment goes towards, not get diverted from response, but also goes towards prevention, and multi-year and multi-sector programs are encouraged so that prevention can take place. With that, I will hand over back to Ron, and thank you very much for being here, everyone.
Thanks very much, Hani, for the clarifications, the emphasis on the primary prevention part of the levels of prevention, the challenges that we're still facing, but the progress that we're making at the same time, particularly through the primary prevention framework that is being field tested. And also the emphasis on showing that it's not just child protection actors that need to play a role, even though we need to ensure that those services are being provided. And the critical role also that donors can play in ensuring that funding goes to prevention work as well. So following now this presentation, we'll want to hear from you again in terms of by means of a Zoom poll. And the question to you is, what is one new thing that you learned so far that is relevant for your work and that you picked up from this presentation or from the earlier remarks Hani did on behalf of Shima? So what is one new thing you learned so far that is relevant for your work? So the reminder of the multi-sectoral approach, reminder of primary prevention targeting all children in the community and addressing root causes, the primary prevention framework, work with communities, resources shared by the Alliance, support protection of children activities through our work on anticipatory action, opportunities to partner with other sectors. Child protection goes beyond the protection services to children. Still a lot of work to do, sure, but we're making progress. Everybody's responsibility to enact prevention in program design. Yes. The three levels of prevention is a helpful concept. Zooming out to protect children, looking to household situation more than just child experience. The prevention measure as important as response to survivors. Excellent. So quite a bit of learning there. Thank you very much for your responses. And what we will do now, we will go to the next part of this session, and we will be looking at good practices from the field. Again, if you have any questions based on the presentations, please use the Zoom Q&A function for your questions, and we'll take them at the end of the session. So we will first hear a presentation, a case study, on actually piloting the primary prevention framework. This will be done by Ilenia de Marino, who is from Plan International, and she will be presenting on the piloting or field testing of the prevention framework. And Ilenia is the prevention project manager interim at Plan International. Ilenia, the floor is yours.
Thanks, Ron, and good morning, good afternoon, and good evening, everyone. Once again, thank you so much for joining this session, and thank you also to the organizer for giving us the opportunity to share our experience in piloting the primary prevention framework in South Sudan and Niger. This year, we have presented the first learnings from the piloting project in different platforms, focusing mainly on preparedness, needs assessment, and design phase. As this project is really progressing, and now we are at the implementation stage, we have decided in this occasion to look more closely at the log frames and the activities that we have selected together with the children, adolescents, and the wider community in the two piloting countries. If you can go to the next slide, before going into the log frames and into the activities, I just wanted to give you a short overview of the steps that we took in order to identify the harmful outcomes to be addressed, and also the risk and protective factors that we took into account once we started to design the log frame and the activities. As you can see in the slide here, the first step was, of course, to socialize the primary prevention framework, as it is a new resource. And South Sudan and Niger are the first piloting countries. We did this socialization both with Plan International, but also at the cluster level. Then on the second step, we developed the tools to conduct the focus group discussion for the needs assessment. And we adapted the guide that was provided by the Alliance. Once we done the focus group discussion, the third steps was to identify, of course, the risk and protective factors through the focus group discussion, but then analyze and ranking the risk and protective factors. And we used the identifying and ranking risk and protective factors guides that Hani showed before, and that was developed by the Alliance together with the primary prevention framework. As the framework really emphasizes the participatory approach, we also organized an interpretation workshop to identify the most relevant activities to address the harmful outcomes by taking into consideration the main risk factors and building up on the protective factors. Finally, as the last steps, we developed the log frame, the budget, and the M&E plan. And here I want to pause, and I would like to, highlight that a lot of effort was dedicated to develop an M&E plan that would allow not only to measure, the effectiveness of the project in itself, but also the impact and effectiveness of the prevention framework. As again, one of the objectives of this piloting project is really to evaluate and potentially adapt and amend the framework. Next slide, please. So through a desk review and also through conversation and validation with different key stakeholders, both countries identified child marriage and child labor as the main harmful outcomes to address. For a number of reasons, including, as always, time and budget restriction, the team in South Sudan decided to focus on both harmful outcomes, while the team in Niger decided only to focus on child marriage. The next slide that I want to show is just to give an idea of the analysis and prioritization of the risk and protective factors. The teams ranked risk and protective factors according to impact and feasibility. So you can see in the slide here that the top right corner would automatically show the risk and protective factors which have the highest impact and are more likely to be acted on. And in general, both in Niger and in South Sudan, the main risk factors were a lack of access to livelihood, education, both in terms of access to education and quality of education, and also birth registration. While in terms of protective factors, again, we looked at quality of education, inclusive education, but also positive parenting and ability to meet the basic needs. So in the next 2 slides, we are going to see the log frame from South Sudan and Niger. And the one that you're seeing now is the one from South Sudan. As you can see, is a very simple log frame with 2 outcomes, which are focusing on livelihood and education. In fact, during the focus group discussion and also the prioritization exercise, it came up that improving both enrollment and also improving the quality of education was a key protective factor, because it actually came up on the right-hand corner, as we saw before, as having a high level of impact and also feasibility. And this protective factor would also help to address other risk factors, like, for example, negative peer influence. The second part on livelihood, as many of risk factors, including the inability to meet basic needs, the lack of access to services, but also the inaccessibility of school. And that means, the inability for pay for, the uniform, of the fees, or the school materials, could actually be linked to the access to livelihood. So in the next slides, you will see the log frame from Niger, which, as you can see, as an extra outcome. And similarly to South Sudan, 2 outcomes are one for, education and the other one for livelihood activities. But the team in Niger also found that working on birth registration could have impact or would have impact on child marriage. And in fact, they decided that mobilizing and sensitizing the community on the importance of birth registration is the first step to prevent harmful outcomes. In fact, children without a birth certificate, they don't have an identity card. And therefore, it's very difficult for them to claim their rights, to access education, and to access healthcare. And they're also more likely to be victim of economic and sexual exploitation, because not having an identity card, they are not entitled to protection measures that are provided by the government. And how the team decided to approach this issue is, first of all, with sensitization campaigns in targeted community on the importance of knowing the birth registration process, but also the understanding the importance of timely registration. And second, also to conduct community mobilization and door-to-door campaigns to support birth registration at community level. Next slide, please. Now, Hani mentioned this already, the multi-sectoral approach. And the primary prevention framework really promotes a multi-sectoral approach in order to prevent harmful outcomes at population level. We talked already about the birth registration, but I wanted to focus just quickly a bit of the education and livelihood components. So as we all know, in certain community, the passage from, or the switch from childhood to adulthood doesn't really follow the legal definition we are used to. And culturally, at a certain age, which of course varies from community to community, children are considered to have reached maturity and can start supporting their family. So given the limited household income, caregivers most of the time or many times adopt negative coping mechanisms such as, again, child labor and child marriage. And in both contexts, in both South Sudan and Niger, school enrollment as well as school retention came up very strongly as a protective factor. In Niger, the focus is to conduct back-to-school campaigns to raise awareness on the importance of education, and also equipping teacher and student government association to create a more inclusive educational environment. In South Sudan, on top of that, the activities will also focus on providing school uniform and education material. So to encourage children, but also parents, to send children to school. And lastly, we have livelihoods, and the activities will focus to support caregivers to access income-generating activities. And that this will help ensure students to stay in school because they will be less likely to look for work. And it will also reduce the risk of child marriage because, of course, the stress associated to the inability of meet basic needs will be partially alleviated. And in both contexts, in both countries, there will be cash distribution. And additionally, in South Sudan, the team has also decided to set up VSLA, so the Village Savings and Loans Association, in order to give households the opportunity to set up their own business. Next slide. I just wanted to share with you some lessons learned from this first stages of the piloting. So it came up very clear that to reach children and adolescents at population level, we need to include the wider community to get a better understanding of the harmful outcomes, but also to identify the more feasible and impactful activities. This will help us make strategic decisions when selecting activities. The primary prevention framework is also, as I mentioned, a new approach, and we have the opportunity to think outside of the box. So we can distance ourselves to some of the prepackaged or ready-made activities. During the design, another lesson learned is that during the design phase, we really struggled to select some indicators that would allow us to measure the impact and the effectiveness of the prevention framework. So we needed several discussions and reviews together with the MER team, and we came to an agreement. But this will really taught us to plan ahead and also to budget accordingly for M&E activities. So my last slide it's on updates and next steps. So I can give you the very, most recent updates. In Niger, we have finalized the data, the baseline tools. We finalized data collection, and we also, the baseline report is under review. And we also have started implementation. So very soon we will also have some virtual monitoring visits, and we can also reassess the risk and protective factors. In South Sudan, it's going a little bit at a slower pace, but we had a kickoff meeting in Juba and Yei in order for the team to understand roles and responsibility, but also donor compliance, of course. Baseline tools at a review stage, and data collection hopefully will start in the next weeks. So as you can see in the slide here, I just wanted to highlight a little bit the M&E part of this project. And
Elenia,
yeah?
Sorry to interrupt. Can you bring it to a close, please?
Yeah, sure. Sorry.
Thank you.
So yeah, we're going to have two different evaluations. One, it will be evaluating the pilot project itself. And the other one will, as I mentioned before, evaluate the primary prevention framework, so the effectiveness of the primary prevention framework. And we will use a qualitative approach mostly, and we will have a lot of feedback from child protection practitioners. So sorry for having taken possibly a minute more, and thank you so much for listening. Over.
Thank you, Elenia. Very useful to see how the prevention framework goes from theory to practice. And see how you put in a very structured approach to the field testing or the piloting. So without further ado, I'm going to hand over to Imtiaz Nidoy, who is from Street Child UK, program manager, and he will tell us about his experiences on prevention, and particularly how primary prevention work shows positive outcomes for children. For example, assessment of risks and protective factors to inform prevention programming in Bangladesh. Imtiaz, over to you.
Thanks so much, Ron, and thanks so much, colleagues. Yeah, let me have the presentation. So, yeah, as I would like to share my introduction first. This is Imtiaz Nidoy. I work for Street Child UK, currently based in Dhaka, Bangladesh. So basically, we're going to discuss about the violence prevention good practices in the Rohingya refugee camp and Cox's Bazar, and I think how primary prevention works in here. So yeah, next slide, please. Fine. So you can see here that I think this is a kind of like a bit of information about our research work that we have done in Cox's Bazar to understand what's the current existing practice on violence prevention, and I think how the prevention works in here, and I think what's the early intervention that we are talking about in terms of like child protection in the Rohingya refugee camp. Here you can see we have selected a local partner to conduct the research. It's called Friends in Village Development, FIVDB. The timeline of the research was in July 2021. So it was in the camp. So basically the rationale of the research is about, to evidence-based violence prevention best practice, which will strengthen the primary intervention in the Rohingya refugee camp. Next slide, please. Cool. I'm not going to tell about a lot of things about the logic model in here, but I think the main key point is here about, you can see the impact. The overall impact is about to improve the knowledge of violence prevention and child protection preparedness at the very rural level and the very root level where we work at the field level. At the same time, there is some outputs as well, where a local organization maybe can put themselves, to create some strategy on early violence prevention. At the same time, how a local organization can involve themselves in kind of like violence prevention mechanism. So it is like super important to engage the local organizations, is because they know the context, and I think they have the access and accessibility, to work over there within a very closely monitoring system with the beneficiary. And at the same time, it is like super helpful to involve the local organization, as they are kind of like bring the ownership of any kind of violence prevention strategy, as well as early prevention mechanism as well. So basically, I think the sustainability works in here when you work with the local organization in terms of, engaging the violence prevention practices where you're working at the field level. So sustainability is another key where we are working to work with the local organization to ensure the violence prevention things, early violence prevention things at the field level. Next slide, please. Sure. So here you go, the research methodology. So basically, you can see there's a very kind of, we have chosen kind of mixed approach to do the work and the research. So there was a kind of like key informative interview, and then in-depth interview we have done as well. There were some semi-structured questions. So basically, the kind of like work in here is that we have done some literature review and secondary data before starting the research, setting up the question, but I think we have done a lot of consultation with the local organization, civil society-based organization, and then international organization, and then UN agencies as well, to understand the violence prevention strategy, the early violence prevention mechanism, what is the existing violence prevention strategy in the camp, and I think what can be done on a way forward. Next slide, please. Cool. So this is kind of like, the existing practices you can see is because not practice, it is kind of like the root causes of violence we have found from the research. So basically in the Rohingya refugee camp and the host community, you can see is kind of pretty much similar. We found the data. So kind of like no livelihood support for the parents, and there is the economic hardship for the parents for the host community, and no livelihood support for the parents in the Rohingya refugee camp, kind of very similar. And then polygamy in the Rohingya refugee camp, rigid social norms, parent face psychological distress. This is so high. And then lack of awareness about child safety, gender equality, drug smuggling. So this is kind of very similar things we have found in the host community, and as well as in the Rohingya refugee camps among the children as well, and their caregiver and parents. So basically what I'm talking about is that, so it is super important to understand the root causes of violence, and then we can take some preventive mechanism to prevent the violence at a very early level, at the very beginning level. So this is like the kind of like root causes of violence we found from the research. Next slide, please. Cool. Here you can see the existing prevention intervention we found from the research in the camp. So basically one is like sharing the child protection minimum standard by the CP subcluster over there. So CP subcluster works underneath of protection cluster, who used to share a lot of child protection minimum standard data with the partners, so they are aware of what to maintain in the child protection arena. And then positive parenting training for the parents and caregivers is being provided by a lot of NGOs, a lot of UN agencies as well. So community-based child protection committee is a very important thing. So how they are engaging the community people to protect the children on a 24/7 basis. Conditional cash transfer is also ongoing by some of the local and international NGOs as well over there. Adolescence Club, ECD program. ECD means Early Childhood Development Programs. Psychological support sessions is ongoing for the Rohingya refugees as well. So I'm not going to talk about all the existing prevention intervention, but I think here you can see the list of we found from the research that's been ongoing in the camp. Next slide, please. Okay, cool. So what happened next, right? So after the research, what we have done is that we have shared the existing practices, like what is going very well to prevent the violence things at the very early level. So emphasizing the early prevention things on the children. So we have shared the research result with the CP subcluster, other cluster, as someone is talking before about the cross-cutting issues about linkaging between the CP cluster and the education cluster as well. So we have involved that kind of cluster as well, like CP education, GVV sector as well, gender-based violence subsector. So that kind of sector has been informed about the research results. It's been shared with them, and then local and national and international agencies been involved, where we share the research report. In-country child protection network in Bangladesh was also involved over there while we share the data. And then
Imtiaz, sorry to interrupt. You have 2 minutes left.
Thank you so much. I will finish that within 2 minutes. So the second point is about, like how we incorporated the primary prevention strategies in the program design. So it's been shared with a lot of NGOs, and the local organizations. So they involve and then they incorporate their prevention strategy in their program design. So in the challenge section, you can see lack of funding is ongoing in the humanitarian setup, short-term fund allocation with no and little focus on prevention. And I think another important point is that having the capacity of the local organization, so you need to work a lot with the local organization when you are making them lead to prevent any kind of early prevention mechanism. So that's been a challenge as well. Next slide, please. Cool. So I think this is the recommendation that we found from a lot of stakeholders in the camp and out of the camp, from the government as well, from the research. So the green line here, you can see that's been already ongoing. So children representation in camp. So as I have mentioned, that there is some CBCPC committee, Community-Based Child Protection Committee. So you can see some of the adolescents are over there as well to represent themselves, sharing the issues. There is some CP camp focal point. There is some system standing on prevention issues ongoing. So for example, I think a lot of organizations are providing a lot of training on child protection. Government engagement is also ongoing as well, so they are actively engaging. But for social behavioral change program, the violet color points you can see in here is kind of like we need to take the consideration as a feature, as an onwarding programs as well. You can see the implementation of legal framework, activation of child affair desk in the local police station, awareness raising and information sharing and corporal punishment. That should be addressed in the future programs from other NGOs, from other cross-cutting sectoral issues as well. Next slide, please. I believe that's the end from our end. So I think, so this is mostly about the data we found from the research, as well as I think how the research is involved with the early prevention mechanism. This is like super important. And as I have mentioned, that the recommendation we should incorporate in our future programs. So that is like also have a close connection with the early prevention things. Back to you, Ron. Hope you enjoyed the presentation, guys.
Excellent. Thank you, Imtiaz, and very, very interesting to see again in practice how you work on prevention in also a challenging situation, and how you bring in the different actors. And I like the fact that you've also had this research component in your work, which helps you to adapt and to make changes as necessary. So thanks very much, Ilenia and Imtiaz, for the field practices. we're now going over to the session where we will hear from donors and their reflections on prevention. We will have Elsa Laurin, who is with ECHO. She's the protection and gender technical expert, as well as Sabine Eismann, who is the desk officer for gender, age, and disability in humanitarian action of the German Federal Foreign Office. Without wasting time, I will hand over to Elsa to give her reflections or ECHO's reflections on what we've been discussing around prevention. Elsa, over to you.
Thank you, Ron, and thank you to invite me, and very enlightening presentation earlier, and reflection also from the other colleagues. I guess from my end, as ECHO, as a humanitarian donors, it's true that sometimes we find it a bit difficult to engage in prevention, in the primary level of prevention, and often the case, most of the project that we would receive and where we would invest would be more, falling under the level 2 and 3 of the pyramid. But that doesn't mean that we do not see the primary prevention as critical. On the contrary, I think it's just a matter of trying to get a bit more evidence and research outcome that we just gained when I heard the previous intervention, and to be able to demonstrate. But what I would, we as ECHO, and probably within the humanitarian donor community, it's true that we have a bit of difficulty to see how we will be able to address the root causes of our social norm within a very short funding cycle that can come from 6 months to 1 year. Within the EU, we have other financial instruments that are more development oriented, and we are trying to work very closely with them from the onset of the humanitarian crisis, because we do believe indeed that prevention should be part of the humanitarian crisis, and not necessarily something that we need to do only before or after, but that should be also part of the program response. What I get from and what we've been discussing also with some other colleagues is maybe a few key takeaways that also were reflecting during the earlier presentation. Basically, that we do need solid in-depth protection analysis to inform protection program and prioritization, and that is very crucial for donors, and that will also help to inform prevention. To do that, I think we will still continue to promote the multi-sectoral approach that is critical to build protective environment for children, but we are very much aware of sometimes the limitation and the challenges to actually have a protection risk analysis and protective factors analysis as part of the other sectors assessment. We still find multi-sectoral needs assessment in the aftermath of the crisis that do not integrate the protection risk. And there we are missing huge opportunity to actually contribute to prevention or to mitigate anticipated protection risk. So, which is really something that we will need as donors to continue to fight for, let's say, or to promote, most definitely. So we will continue to advocate at all levels. I think that we need to use all entry points. So we have donors platform, protection related, but there are also regional platform, regional entry point that can also be used to promote that multi-sectoral approach and to make sure that sectors are not working alone. The humanitarian setting sometimes doesn't help. Some of the sectors continue to work in silo. So I think there's still a lot to address, but we do also see a lot of progress in that regard. In the meantime, lots of discussion around that. So definitely an effort to be continued. The other thing that came out also very strongly during the presentation, and that we will continue to promote as well, protection risk analysis and protective factors being key to inform prevention program cannot be done without the community. So we need to make sure, and we had a very good example earlier, again, community need to be involved. They need to lead and to own the assessment of the protection risk and the protective factors. They're in the best place. We know that. We've been saying that for ages, but let's continue to say it and to promote that and to make their engagement meaningful. I also know as donors that it means resources. It means also long-term engagement. I hear all the partners saying that. But I guess sometimes, it's not only looking at the funding cycle as an entry point, but more to see how does it fit within a broader intervention. So basically looking at the longer term vision and the prevention and how we will fit our intervention. So when it comes to community-based protection mechanism, we heard about it, the CBCP, make sure that they are not only project design or part of only on an organization. They should be part of a broader prevention strategy that also go beyond awareness raising. Maybe one thing on that is that often the case we receive or we see a lot of awareness raising, but that is not necessarily based on this protection risk and these protective factors. And it's not enough to actually prevent harmful outcome within the humanitarian crisis. So that's maybe also another key takeaway that I wanted to really make sure, to highlight, echoing what the other colleagues have said earlier. And I'll finish maybe with the nexus, inevitable nexus, which is super important for us as ECHO, because as I said earlier, we are short-term funding. But our role, and I would echo Hani, that was earlier saying that we are all accountable to make sure that we have a continuum of care and to make sure that we do contribute to prevention, donors as well. Now we need to find ways to fit into that frame and that language when, again, we have so short-term funding cycle. But I think that what we do, for instance, within ECHO, within the European community, we have different financial instruments, and we are trying very much to work with them from the onset of the crisis to make sure that we do not hand over projects, but we actually work together in designing projects within a longer term approach, so that then we can kind of transition the protection concern that we can address only with a long-term cycle, but with our short-term funding are difficult to respond to. So there's also a lot of discussion within the donor community. And I think we all recognize the importance of bringing donors, humanitarian donors and development donors and broader key stakeholders at the table from the onset of the crisis to be able to design a more sustained intervention and to contribute to the prevention element, the primary prevention element of the pyramid. That also implies working with the system strengthening is something also that as ECHO is a bit complicated for us to do. But again, we have other financial instruments within the EU. We know that other donors can do that. So again, collaboration from the onset of the crisis on trying to see how best to sustain the short-term intervention and to ensure that we actually do not do harm by disrupting services within that short-term funding cycle. So yeah, I think I will stop here. And thank you.
Thank you, Elsa, for these helpful reflections and also the key takeaways around collaboration. I think that's with a big C, I guess. And but also to particularly looking at when we're starting the assessments, the multi-sectoral assessments, how do we ensure that the centrality of the protection of children is also part of that, and not an afterthought or not a thought at all. And that whatever we do in terms of our programming, that we always look at that from a prevention strategy and being part of a larger prevention strategy than just a small project that tries to address hopefully something that has been identified in a community. Sabine, over to you for your reflections.
Thank you very much. I'll try not to repeat too much of the excellent input that my ECHO colleague has already given. Thank you very much for that. And I just will give a bit more of a Germany-focused input. And a lot of these things that I heard today ring true and very well known for me because as you can probably see, I am responsible for gender, age, and disability on my desk, and many of these things that we heard about child protection and the need for cross-sectoral cooperation and the inclusion of risks in early stages and preventive measures are equally true for all parts of the protection spectrum that we look at, and we know these discussions really well, and I think it just goes to show that it is really a systemic change that we need, a change in the way the work is being done, a change in the way the coordination, the planning is being done, and in the way we simply integrate all elements of protection into the humanitarian system. So let me just put this before. So we know that we know that we are aware that we need a dramatic shift as needs continue to rise. Funding doesn't necessarily continue to rise. We all also know about this fact, and we have to ask ourselves. So I'm not going to start with answers. I'm just going to start with questions. Between a humanitarian program cycle reform and efforts to slim down HRPs, for example, how can we ensure that the specific needs of children are adequately met? A few answers were already given, but this is something that we are always thinking about. And with efforts to move towards a stronger local leadership, as for example, through the flagship initiative, how can coordination system adapt to local realities, and how can we make sure local communities are heard in that, and how can we make sure that they are heard right from the very beginning? Because prevention obviously is essential, especially in protection matters. If damage can be prevented, this is always the best outcome. And we've heard about it in protection matters. This is especially important because when we talk about physical violence, when we talk about GBV, when we talk about early marriage, recruitment for fighting, but also child labor and other damaging practices, this can lead to lifelong trauma. And as is always the case, prevention is more effective and cost efficient, obviously, than the response, and then dealing with the lifelong trauma that can be afflicted. My ECHO colleague already said, and
sorry, we've lost Sabine. We're trying to.
Yeah,
Sabine,
you just lost me.
Getting back. Please continue.
My connection just dropped.
Please continue. We can hear you.
Okay, great. Thank you very much. It's the connection in internet connection in Germany is really a thing of beauty. So I will try to be really quick. We have to avoid siloing in humanitarian coordination. I mean,
Sorry, we lost Sabine again. We'll try to, hopefully she will be able to get back.
So what we try to do, and I hope I'll stay online now.
Yeah, and if it works better without the camera, please do so.
Yeah, I'll just turn my camera off just to make sure. Within our child protection and humanitarian assistance, we try to implement prevention through capacity strengthening. and not only, with local organizations, but also in an institutional and coordination way to make sure that we have the capacities available to also be able to accommodate local organizations and community engagement, and that we implement child-friendly accountability procedures. That was also said already during the presentations, but I want to underline how very important it is to include children and young people in accountability procedures, how to create safe spaces for their participation, to hear their voice, and make sure they can also act with agency and as their own, that with a self-confidence in that their voice and their opinion really matters. With Plan International, we're currently piloting the prevention framework in Nigeria and South Sudan. We're really, really happy to be able to support this. And the second focus that Germany has in its humanitarian assistance is anticipatory action. Now, obviously, anticipatory action is not the same. It's horrible. I keep dropping. I'm sorry. I was with you all the time.
You're back.
Okay, so a second focus that Germany has is anticipatory action. And of course, anticipatory action is not the same as prevention. We're aware of that. But we have to include prevention or child protection also within anticipatory action action measures, because women and children are incredibly more likely to die from disasters, for example. And this is why, for example, we try to use disaggregated risk analysis and special triggers that take risk factors such as child protection factors into account, and also gender and inclusivity sensitive anticipatory actions themselves, obviously. Also here we are working with Plan International, for example, on Philippines to put into action a child-centric anticipatory action framework work. And I think this is something where really also different channels of work can inform themselves. And it's just incredibly important for me to underline the need for truly mainstreaming child protection issues in humanitarian coordination and planning. For example, to make sure that when child protection needs are obviously not met, that there can be extraordinary meetings, that there can be convening of coordinators, donors, and protection actors to make sure how to address the shortages of funding, how to address shortages of implementations if there are. So there are many different possibilities. And what I would like to underline is that I think the different subsectors of protection could also very well learn and inform each other. And I know that they are doing this, and I know that the Child Protection Action Network is especially active and has a wonderful output. And I would really love to see also kind of a cross-cutting of these discussions that we are leading, just to make sure, as I said, that we do not hold the same discussions all the time in different fora, but that rather we make sure that we streamline whatever and mainstream whatever we can mainstream and learn from each other and put this into action. So thank you very much.
Thank you, Sabine. Very helpful, very interesting also to hear your focus on the anticipatory action. And what I liked also about your reflection is on the accountability procedures, and to ensure that children and young people are part of those accountability procedures and have safe spaces to raise their concerns or their issues. Very, very many thanks, Elsa and Sabine. It's great to have your reflections and have you here on the forum and the session. We don't have a lot of time left, but we'll try to see if we can squeeze in a few answers to questions. We've had quite a number of questions, and hopefully we'll be able to get back to some of those at a later stage as well. But for now, there's a question, Hani, I'll get that to you. How can we strengthen collaboration with other sectors on prevention, who are also struggling with competing priorities and with requests for mainstreaming several cross-cutting issues? I know the Alliance is working across sectors, so any insights you may have?
Great, Ron. Thank you very much. There are a couple of, excuse me, specific learning points that we have had in trying to work with other sectors, and I'll mention those. Of course, we don't have a silver bullet of solving the problem of working with other sectors, but these learnings may help. One is that we have seen when we speak the language of child well-being and healthy development, that unlocks a lot of doors. In the sense that if you are talking child protection language with an education person or a livelihood person, it's hard to get them to want to work with you, whereas they can't argue against being part of ensuring child well-being or child healthy development. So the moment you start shifting to that language and talking that language, you can actually engage with them because they see themselves as part of, I mean, this is part of how all the rights of children are connected to each other, right? They all work towards child well-being. The second thing that I will say, and I'll leave it at that because I know we don't have time, is important that we don't tell other sectors or ask other sectors to contribute to our outcome. We are telling them that you do what you do. If you're an education person, continue doing an education person. If you're a livelihood person, continue doing a livelihood thing, but with a new lens, and that lens is a child-focused lens and a prevention lens. So when we engage them, we're not asking them to do child protection. We're asking them to do WASH. We're asking them to do nutrition, which is what they do anyway. It's just a slight shift in the way we do it that will then help us prevent harm to children. I'll stop there. Over back to you, Ron.
Thanks, Hani. Excellent point. It's also something I recently heard from colleagues in Oxfam in saying their programming, your WASH program is quality programming if it includes a protection or a child protection lens, and that then becomes their responsibility and not something that they do for child protection. One final question that I will try to squeeze in. Ilenia, this is for you. If you could give as much as possible a quick answer. Any feedback on any insights into gender consideration in the projects that you have supported in South Sudan and Niger? And maybe just one example that you could provide us with. I know it was child marriage, so that certainly has a gender component to it, but anything you may add to or answer that question. Thank you.
100%. Thanks. I will be very brief. So, of course, in just to say, in Plan International, we do, try to do all our project and programs with the gender lens. We focus a lot on adolescent girls. And as far as I know, in South Sudan and in Niger, when it came to data collection, we did use the age, gender, and disability approach when collecting data. So all the data that we collected was categorized or was taking into consideration the age, the gender, and the disability or diversity of the participants. And of course, as you mentioned, we did focus on child marriage, that it, as we know, is experienced at a higher rate by adolescent girls. So that's very quickly. Thank you.
Excellent. That's very, very nice to have this quick answer. Any of the speakers, if you want to reply to the questions in the Q&A, please feel free to do so. We are reaching the end of this session. I would like to thank all of you as participants who've signed in, over 200, which is great to see. To thank you for your attention, your questions, your participation in the Zoom poll. Also, a big thanks to our speakers, to Hani, to Ilenia, Imtiaz, Elsa, Sabine. Great to have you on this session and to have such a variety of inputs on these important topics, but also to hear your support for this work and how you practically put in place prevention, particularly primary prevention work. And then finally, also a big thanks to those who have helped organize this. You don't see them, they're behind the scenes, but Chiara, Elsbeth, and of course Julie, thanks very much for all your support, and sorry for those if I've forgotten to mention your name, but great to have you here, great to have had you with us, and wish you a great rest of the day. Thanks very much.